you actually need a good amount of estrogen for men to have libido or sexual desire. So it's not only testosterone that helps with desire, estrogen or estradiol helps with desire. In Western medicine, when you look at the research, it actually shows that when men don't ejaculate enough, there is an association with prostate cancer.
Is it true that men have about half the sperm count as generations before them now?
Dr. Geo Espinosa
is a groundbreaking naturopathic functional medicine doctor and one of the world's foremost authorities on men's health and urology.
As the first naturopathic physician to complete an internship, residency, and fellowship in urology at Columbia University,
Dr. Espinosa has revolutionized how men approach their health.
A prolific researcher and published author, he has contributed extensively to scientific literature and is the author of the best-selling prostate cancer guide, Thrive, Don't Only Survive.
As clinical assistant professor of urology at New York University Grossman School of Medicine and co-founder of XY Wellness,
Dr. Espinosa continues to lead the charge in integrative, science-backed solutions for men's health.
One of the things I do in most men is actually do a semen analysis, even if they're not coming for fertility issues. That's sort of a barometer to their overall health. And one of the things that lowers testosterone is
we're seeing a lot of the media say testosterone is lower in men who are, in their 20s, have lower testosterone than men in their 40s. What's going on?
I don't want to oversimplify it, but I think that is a combination of...
Welcome back to the Dr. Brighton Show. I'm your host, Dr. Jolene Brighton. I'm board certified in naturopathic endocrinology, a nutrition scientist, a certified sex counselor, and a certified menopause specialist. As always, I'm bringing you the latest, most up-to-date information to help you take charge of your health and take back your hormones. If you enjoy this kind of information, I invite you to visit my website, drbrighton.com, where I have a ton of free resources for you, including a newsletter that brings you some of the best information, including updates on this podcast. Now, as always, this information is brought to you cost-free, and because of that, I have to say thank you to my sponsors for making this possible. It's my aim to make sure that you can have all the tools and resources in your hands and that we end the gatekeeping. And in order to do that, I do have to get support for this podcast. Thank you so much for being here. I know your time is so valuable and so important, and it's not lost on me that you're sharing it with me right now. Don't forget to subscribe, leave a comment, or share this with a friend because it helps this podcast get out to everyone who needs it. All right, let's dive in. Dr. Geo Espinosa, welcome to the podcast.
Thank you so much. Thank you for having me.
I am so excited. Now, for everybody listening, this has been highly requested because all the ladies in my audience are like, I need the info for my hubby or the man in my life. So we're going to talk testosterone today and how to optimize what gets called the male hormone. Women have it as well, but we are specifically applying this to the male body. Right.
Testosterone, is the male hormone only because it's significantly higher in men, right? Mm-hmm. And many people are still confused about it.
Yeah.
Including clinicians, honestly.
Well, that's why you teach doctors.
That's right. That's right. We're at a perfect conference here where they talk a lot about it. And again, there's a lot of misinformation out there. So why don't you ask questions and I'll answer if I can.
Oh, I'm going to. What are the biggest myths around testosterone?
That total testosterone is everything. That's number one.
So this is a blood panel. Total testosterone is not everything. What should the people look for instead?
Well, here's the deal, right? So the range is somewhere between 300 and 1,000 or 900 or whatever. That's a wide range. So there are times where just yesterday clinically or the day before where a patient comes to 1,200. Mm-hmm. He feels low libido. Things are not right. What's happening? He doesn't have enough free testosterone. Mm-hmm. The magic is in the free testosterone. You could have 3,000 testosterone if the percentage that's free is below 2%. Mm-hmm. It's not going to do what it's supposed to do.
And how will people feel if their testosterone's too low?
They feel like if they have low libido, low desire, a little bit more like mental fatigue, a little less of a zip in their step. Actually, that's the way they describe it. Executive decisions are, they lag a little bit, those kinds of things.
Yeah. And that's an important thing to note, because whenever we talk about executive function, people go right to neurotransmitters, not recognizing that there's such an interface between hormones and neurotransmitters in the brain.
1,000%. Dopamine and testosterone, they're like, right there next to each other.
Yeah.
The receptors are right there next to the brain, in the brain. So it's a very important component. And just general like fatigue, that's abnormal to them, right? They just, that's the way they describe it anyway.
Okay, so we don't want to look at just total testosterone. We want to look at free testosterone.
That's
Are you
right.
also looking at sex hormone binding globulin?
1,000%. So that is the thing. So sex hormone binding globulin is attached to the testosterone really tightly and doesn't free it up.
Yeah.
So you want to do things that may modulate that. You still need it because you don't want to have 5% free testosterone. Men will go crazy.
Or high estrogen, because that's going to be a problem.
So that's the second myth.
Yeah.
We could go to that if you want.
Yeah.
So-
Okay. Let's talk about what to do about modulating sex hormone binding globulin,
Right.
and then let's get to the estrogen.
So high carb intake elevates SHBG because it's made in the liver, and all kinds of liver things happen when there's insulin resistance and those kinds of things. So a high carb diet is not good for many things, simple carbs, but certainly not good for SHBG, to have enough SHBG in the body. That's number one. Number two is, there's some herbals, unless you want to go there now, we could wait towards... So we could discuss all the herbals that,
No, let's talk about it in context of sex hormone binding globulin.
So
globulin.
one of the ones that it's used for prostate problems typically is nettle root. So a lot of formulas with testosterone have them, but the thing is that they have nettle leaf. It's not the leaf, it's the root. So buyer beware.
Yeah.
Right? They need to take nettle root, and I would not do it in a formula. They need to take enough of it, somewhere between 500 and 1,000 milligrams a day in order to modulate SHBG so they have enough free. Also, Tonkat Ali has a lot of benefits. That's the name that's known in the brand name.
Yeah.
And one of them is that it lowers or modulates SHBG, I should say. If it's already very low, it's not going to lower it more than that. So those are the two biggies, I think, in the herbal world that can help with that.
Okay, so if your sex hormone binding globulin is elevated and your free testosterone is low, but your total's looking fine, these are a couple of things that people can use to bring down that binding protein, and so that they can optimize that free testosterone.
Correct.
All right, I love that.
Yeah.
Let's talk about the myth around estrogen.
The myth around estrogen, right? So with men, as it relates to men, is how low can we go, right? They take these aromatase inhibitors, drugs like anastazole.
Yeah.
And it's provided in many clinics. That's a problem. Why? You actually need a good amount of estrogen for men to have libido or sexual desire. So it's not only testosterone that helps with desire, estrogen or estradiol helps with desire. Aside from the fact that estradiol in men helps with bone health, just like it does with women. So the myth of low or better is a bad myth. So what do? I like my ratios to be around 20 to 1 or 40 to 1, total testosterone to estrogen, right? As an absolute value on estrogen, give or take, I like that to be 20 to 30 nanograms per milliliter in men. Right, obviously, it's much higher in women, right?
Yeah, and depending on where you're at in your cycle.
Correct. Thank you for reminding. It's been a long time.
I know.
I think the last time I saw a female hormone panel, I think I was still in school, actually, like over 20 years ago.
You know what we need? We should have had little headbands or something with like ovaries over here and testes over there.
Although, that would have been cool. Maybe you could create one. You could do anything with AI these days.
I know.
That would be cool.
But yeah, I'm like, this is the testes talk. This is the ovaries talk. Well, it's interesting because you brought up the fact of estrogen being involved in sexual desire, and we see the same is true for women.
Sure.
In fact, when estrogen is optimized, women will have more fantasies. So this is where I'll say to people, like, if you ever catch yourself and you're in the grocery store and suddenly you're like, oh, I'm like in the mood, I'm like checking out this magazine, or you're scrolling social and you're like, I'm like feeling something. Usually you're around ovulation. Usually your estrogen is up.
Oh, good to know. Yeah. I have many women in my life, a wife and 2 daughters, so I don't think I want to have that conversation with my daughter.
No.
I don't think that's a good look. I don't think I want to do that.
Yeah, you're like, how you feeling in the grocery? And they're like, cringe, Dad.
Exactly. I see you looking at that magazine a little too hard. What are you doing in that magazine right there? Right, exactly.
Oh, okay. So estrogen, men need estrogen too. You talked about the ratios, which is perfect. I'm curious what, we're seeing, and is it true? We're seeing a lot of the media say testosterone is lower in men. Like men who are, in their 20s have lower testosterone than men in their 40s. What's going on? Man,
that's true. And I think it's a phenomenon that is concerning.
Yeah.
Right? So I'm talking about men in their 30s. Mm-hmm. I've had a few in their 20s with those. I mean, this is unheard of.
Yeah.
What's going on? I don't want to oversimplify it, and I know we don't have that much time, but I think that is a combination of too many chemicals that are estrogenic in the plastics and cans and things like that, even receipts when they, that's why I think men should, not get a physical receipt because there's estrogenic compounds in what makes the receipt so slippery and everything.
Yeah.
That, it's absorbed in the skin. So I think that's number one. So a lot of it is, or some of it is environmental. Mm-hmm. The other is that, honestly, a lot of these guys are just overweight. They're in a basement somewhere, playing video games and ordering Uber Eats.
Gamer life is not good for your tea.
Well, exactly. I mean, so what happens when a man has a lot of body fat? There's a lot of what's called aromatization in the body fat, where it turns testosterone into estrogen. So while I always say, on average, I never bring down estrogen in a man, that ratio is not 20 to 1 or 40 to 1 in some of these guys. It's like 10 to 1 or 9 to 1 or 8 to 1.
Yeah.
So what's the goal there? Bring down estrogen? No. Bring up testosterone. That's the way you do that. And then, so that's part of the issue. They have, I don't know, that's the fact that they're not moving their bodies, they're not exercising, they don't have enough muscle.
Yeah.
I mean, some of the guys that come to my office and 28 years old, they have like 40% body fat. So that's the other issue. Metabolic syndrome. Right, so they have all kinds of metabolic dysfunction, insulin resistance, hypertension, big waist. All these things contribute to it.
Is it true that men have about half the sperm count as generations before them?
1,000%. Yes, it's a significant decline in sperm count, in sperm health, mobility, every element of that. And I can say that with a lot of confidence because one of the things I do in most men is actually do a semen analysis, even if they're not coming for fertility issues.
Yeah.
That's sort of a barometer to their overall health, and there's a lot of research to support that.
Yeah, I actually say that quite a bit as I've been on a fertility journey, is that I'm like, sperm is, if we could only analyze women's eggs, like we could have so much data about their overall health. But like this is one parameter I don't think is actually tracked and measured enough until there's been a diagnosis of infertility in a woman.
Correct. So yeah, I do a semen analysis on most men that come to my office as a biomarker, as a general biomarker.
And what parameters are you looking for?
I am looking for amount of sperm cells that are produced, that are active, that they look right. They're
not mutants.
They're not mutants.
Not teenage
not
mutant
with
sperm.
Three heads and they're going in different directions. Those kinds of things.
Yeah. So when it comes to low testosterone, so we're seeing the environmental factors, we're seeing lifestyle factors. What are the interventions? We're going to talk about herbs, but I assume there's some foundational things that you recommend to all patients who want to optimize their testosterone.
Correct. So sleep is important, right? So I need them to at least spend an average of 90 minutes or so a night in REM.
Okay.
Right? So they all have their wearables of one kind or another, and we look at that, and they need to be in REM. REM is where the testosterone is actually produced.
Okay.
So that's key.
How do people get into REM sleep? How can you optimize your sleep habits so that you can hit that?
when you exercise in the morning.
It all comes back to exercise.
When you exercise in the morning, you hit more REM at night. And particularly if you do more outdoor things in the morning, the circadian rhythms start working where you get some sunlight, hit your eyes and so forth. That starts the process, the circadian process, where now later on at night you get more REM.
I love that. So if you want good REM sleep at night, you hit it in the morning.
You hit it in the morning. At night, those digital devices, you gotta put those away. They are digital device. I mean, look, here we are. This is probably going to be posted everywhere, right? So it's I can't say
we're like, don't look at us.
No, not right now. Not right now. It's 11 p.m. Put that away tomorrow morning, right? It's a problem, right? By the way, that's also a problem with when we talk about what's the overall problem is digital devices. Not only gaming, but just they're not going to sleep. They're not sleeping.
Yeah.
As a result of being connected overnight. So yeah, that's enough. I mean, magnesium at night. Those are all kinds of things that seem to help. And enough sleep at night. I have not seen either a study or a case that if you get if you get 4 hours of sleep a night, there's enough REM there. It's just not possible.
Yeah.
So my understanding, and even with myself, you need at least 6 hours of sleep a night.
Yeah.
I'm clearly talking as a New Yorker because some people say, that's it, 6? Why not 7 or 8? There's no New Yorker that sleeps more than 6 hours a night. I could know anyway.
I could never live there. I'm a 9 hour a night person.
Oh my goodness. And you do so much, so that's admirable.
I'm very productive.
That's right.
Because I get those 9 hours of sleep.
Yeah.
Yeah. But I mean, when it was so interesting this year that a study finally came out being like, oh yeah, women actually need more sleep. Yeah. And to recognize that men can get by on 6 hours of sleep. Women, when we're in our follicular phase and testosterone's riding, with estrogen, we might be able to get away with it, but luteal phase, it's 9 to 10 hours. Like that's what you need to fully recovered. You talked about exercise.
Wait a minute, one more question.
Oh, yeah.
Let's reverse this. So how about women on menopause? Is it still the same story or no?
Well, here's the thing is that a lot of women going through menopause aren't sleeping well because their progesterone is gone.
Yeah.
And they may still be having hot flashes. And so we're just working to get them optimized and to get their sleep optimized. But I mean, spoiler, we haven't done enough research in menopause altogether, but certainly not on the sleep component. But it is something that, when you look at the sleep studies and you remember IFM had an entire sleep conference.
That's
and I remember there's the praising over and over of naps and like how good it is. So even if you don't get, that 8 hours every night, if you're napping during the day, that does contribute to longevity as well.
I love it.
Yeah. But I want to go to the exercise piece.
Let's do it.
You mentioned exercise. So if somebody wants to optimize their testosterone, we want to exercise in the morning. What's the best type of exercise?
Look, there's no way around it. It's weight resistant to exercise.
Okay.
Because a lot of people think that you raise testosterone when you lift weights, particularly big muscles. So that's your chest, your back, your lower extremities. You raise testosterone. That actually happens acutely.
Okay.
The other element, maybe a third myth. Maybe we can call it a third myth. The other element that's important. It's not, okay, so we know you need to have enough free testosterone, about 2%. We know you need a good ratio between total and estradiol. But the other thing is that those receptors, if they are not healthy and dense and ready to connect with the testosterone, it ain't happening.
Yeah.
So what studies show is that, yes, it increases testosterone acutely, but it actually strengthens those receptors, those androgen receptors.
Yeah.
So from a receptor perspective, this is a guy, is beautiful. This is a guy who has great total, 2% free, great ratios. I don't feel that's a receptor issue.
Okay.
That's a receptor issue.
And that's a lift weight issue.
That's a primary, as best as I know, yeah.
Yeah.
That's you gotta push and pull something heavy and about 2 or 3 times a week.
Okay.
And particularly big muscles. Bicep curls is not doing it.
Okay.
You could bicep curls to the cows come home. That's not doing it. You need back and legs, so whatever. deadlifts, squats, bench press, pull down, something like that.
Okay.
Yeah.
Maybe this is a myth. I'm curious your take.
Yeah.
There are men who will avoid ejaculation because they say it will lower their testosterone.
Yeah, that's a myth.
Okay.
That's a myth. Maybe that comes from like Taoism, right? Because that's what I learned when I did my training in Chinese medicine as well. And I'm like, there's something wrong with that. And there's something wrong with that concept, with that theory.
Yeah.
In Western medicine, when you look at the research, it actually shows that when men don't ejaculate enough, there is an association with prostate cancer. Right?
What is it? Is it 21 times a month?
Correct.
Yeah.
Everybody seems to remember that number.
No, you want to know? You want to know what's crazy?
I want to meet the men. I want to meet these guys with 20. They must have. I want to meet them, check their prostate. I mean, let me. How? But that's what
I have to tell you, I remember where I was when I learned that. I was in Amsterdam staying at this Airbnb. And I can remember the wallpaper. I can remember everything about learning that. And I was like, because I'm married to a man. And I'm like, let's save your prostate.
See, that if women knew that they're actually doing something therapeutic for their man, there would be more intercourse and more quality of life, I think.
And if their estrogen's optimized, then it's a win-win, right?
I tell you, I interviewed on my podcast Minhaj Siddiqui. I interviewed him on prostate cancer. Then I look at that paper of the 21 times a month. He's the author. He's the primary author.
Oh, yeah?
And so when I did some research on Dr. Siddiqui, that paper came up. He was a resident when he wrote that paper. And so what he wanted to do is say, okay, there's already a paper written that men who don't ejaculate enough, they have a higher increase of prostate cancer.
Yeah.
Well, if you live long enough, any man will have prostate cancer. What he wanted to know is what's the association with that advanced prostate cancer, the type that can actually kill you.
Yeah.
And then so that's the paper that he wrote about 21 times a month. So that's apparently what it's about.
Yeah. Well, and I often will get asked by women, like, what's enough? Because there's research on longevity, on optimizing inflammation, like so much about sexual health, and women will say like, well, what's enough? What's enough? Like men, we have this like 21 number. But the thing I always say for women is that it's enough that both partners feel satisfied. Yeah. Men can handle themselves if they want to hit the 21.
Well, they have to sometimes. I mean, there's very few partners that are, I know they're it's very interesting. You would think that many of the people that come see me is like the men are driving us because they're men, and they oftentimes they're female partners saying, "Hey, what's going on? You need to see Dr. Geo."
Yeah, yeah.
Because things are not working out. That must be a very interesting conversation, right? Because men are so in that regard, very much that's part of the ego. And oftentimes it's the woman that brings them in and say, can you check them out?
Well, that's why we're doing this podcast, because oftentimes it's women who bring their men to health, who will support them, who will take them to the doctor, who will be like, listen to this podcast with me. You need to hear this.
Good.
So I'm very curious. Herbs, what works? What is bunk? Let's start with like what's bunk? Like what's out there that you're just like, I hate this. It's garbage. I wish it didn't exist.
One of the herbs that is overused right now, and they're going to hate me, that seems to lower testosterone.
Try to come for us.
Listen, don't come for me. Don't come for me. It's cannabis.
Okay.
It's cannabis.
To lower testosterone?
It lowers testosterone.
Yeah.
Now, the good news is that there's a dose element to it that I don't know what that is, and no one that I've spoken to knows, right?
Well, of course
so
not.
So if you smoke every day, and that's probably an issue, and that's an issue in many ways.
Well, that's what I think of when I think of too much estrogen, and people getting the man boobs and everything is like the recreational drugs.
Exactly.
Yeah.
So cannabis shows up on the list. That's one of the things that lowers testosterone. But some of the things so my big three, and it's going to be part of the lecture this weekend. There are a few, right, that are up there or that people promote. The big three, in my opinion, is Tonkat Ali. Right?
These are the big three herbs that work for optimizing testosterone.
Well, let me come back on that, right?
Oh, okay.
When I say optimizing testosterone, I mean optimizing functional testosterone.
Free testosterone.
Right? The whole thing.
Okay.
Total, free, good ratios. If it's not functional testosterone, it's not you're not going to get the benefits. So anytime I talk about these are the herbs or these are the lifestyle, it's about functional testosterone, right?
Yeah.
So what are those, right? So Tonkat Ali is definitely one. And there's been, some hype around it, and, with good reasons, good studies, systemic reviews. I've seen it clinically, very good. Mm-hmm. The other is, the group is adaptogens. I think adaptogens are great. Why? Because adaptogens, like the name implies, helps the body adapt to stress chemicals.
Yeah.
I know you're a big fan because I follow you.
Because I'm obsessed.
I follow you.
Rhodiola is why I thrive.
Rhodiola. I'm surprised we didn't name our son Rhody.
Oh my
for Rhodiola.
God, right?
I tried. I mean, I'm such a fan. He should be named Rhody. So Rhodiola. But if I have to choose one adaptogen, it's ashwagandha.
Oh, yeah. Well, ashwagandha in women has been shown to increase sexual desire and self-lubrication. So I'm not surprised that you picked that one.
It lowers cortisol. Mm-hmm. And cortisol, people love this, hashtag cortisol castrates.
I was like, cortisol's a cock blocker.
You said it.
I said it.
You said this is your show.
It is.
You
for
could say whatever you
right?
want on your show.
I know, explicit lyrics.
But cortisol castrates, right? So ashwagandha has shown to lower cortisol and to actually increase testosterone and free testosterone, lower estradiol if it's too high, and it helps with proper. So it's good for male fertility as well. Mm-hmm. Actually, the studies that show the hormonal benefits are from fertility studies.
Yeah.
So it increases sperm count and all the wonderful things that men would want and need.
That's amazing. Okay, so what's our third one?
So we got Tonkat Ali, we got ashwagandha. I think epimedium, or known as horny goatweed, is very good.
Such a great name, right?
It's such a great name. And the reason, actually, it's really good. Men who are sexually active, just the act of being sexually active increases testosterone. So it's like, what comes first?
Yeah.
So epimedium is probably as a result of that it has this chemical in it called Icarin. Icarin is what's called a PDE5 inhibitor. Well, what
Explain
else?
that to people.
What else is a phosphodiesterase 5 inhibitor? Viagra, tadalafil, or Cialis, and all those drugs. So there's a little chemical in there that does exactly what some of these drugs do. The question is, do you get enough Icarin from the herbs that you take? So it does help in that perspective if you're able to get enough of the Icarin. The herb is very expensive. To get enough Icarin, it's very expensive. So there's not a lot of good formulations out there, but as just a botanical itself is very good.
You formulated your own product.
Yes.
Is that in there? What do you have in yours?
So there's only so many herbs. You're a formulator that you can put in a product, right? So you're looking at the bigger picture, right? So you're not just looking. There's not a drug. What is the thing that increases testosterone? All right, that's the thing I'll put in, right? I'm looking at the bigger picture. From an herbal perspective, you'd be surprised. One of the things that lowers testosterone is chronic inflammation. And ginger extract, in one great paper, it's only one paper, has shown to increase testosterone in that pathway of lowering inflammation. So ginger extract, no one would ever use in a testosterone formula. I do very successfully, and we studied it, and it does very well. So ginger extract is actually one of my favorites in that regard.
Yeah.
And then there's other. We could stick just to herbals, but if we can talk about two minerals, boron.
Yeah.
Actually, boron lowers SHBG, so it's more free testosterone, and zinc.
All right.
Zinc is important. Magnesium also important.
Eat your steak.
Eat your steak.
Yeah.
Eat your steak. That's right.
Well, let me ask you, because, as we talk about eat your steak, that's a great source of zinc. Do you find that diet plays a role?
Yeah.
Tell me more.
The research is actually very interesting. It suggests that a diet that's not low in fat is better for testosterone.
So the 90s destroyed us all, men and women.
Yeah, those cookies, those Snackwell cookies.
Oh, gross! Yeah.
Remember those Snackwell
or what
cookies?
About the
Low
Olestra?
fat, no fat.
The Olestra chips.
Oh my! Can you believe that was even out?
I know, people are like literally pooping themselves just to not eat fat.
Or from those Snackwells, just getting diabetes and all kinds of other
issues.
How crazy!
I know
that time.
Yeah.
I wonder what was the testosterone. I'm sure it was very low as well.
We were too young.
We were too young. We were too young. So a diet that is not low in fat is actually helpful, according to a lot of research. And I guess the connection there is that this is with cholesterol. Actually, you need cholesterol. If you want a man to really struggle to make their own testosterone, have their cholesterol go down really low.
Yeah.
This is, sometimes they come to me, it's funny but not funny, right? They come to me very proud that, look, my cholesterol is so low.
Yeah.
My cardiologist says it needs to be low. And that's the worst thing that a man can do, is to lower their cholesterol to the point that they cannot even make their sex hormones.
So does it need to be like above 150?
Yeah. I mean, way above 150.
Okay.
First of all, I'm getting excited here because...
Well, I've seen cardiologists be like, you got to get it 150 or lower. So that's why I'm asking.
And they're barking at the wrong tree. I think many of us know that. And even my cardiologist friends know this as well. That's a different conversation with bad cholesterol, LDL. And
inflammation. 20 years ago, I was taught that inflammation was the driver of cardiovascular disease. Yeah. But even still, I'm like, I was taught that in nutrition 20 years ago, and here we are, and there's still people being like, it's just about the cholesterol.
Can you believe it? Yeah, we did learn it when we were in school that long ago, and here we are. Now it's like a big thing. It's funny, a lot of the things we learned as naturopathic doctors back then are... Right?
Yeah.
So hydrotherapy.
Yeah.
That's part of our history.
Is it not crazy?
And now cold plunges and things, right?
When I tell people that, song on his cold plunges, like alternating hot and cold, apple cider vinegar, castor oil packs. Like when I talk about all that, and people are like, oh yeah, I just learned about that and this new thing, and like this influencer taught me, and I'm like, this is so wild to me.
And that's why you're your own influencer, getting the right information right out there. By the way, cold plunging, I think, also stimulates production of androgen receptors.
Oh, okay.
So there's benefit there as well.
Yeah.
Not to completely digress.
Yeah, no, but I love that. So it's the strength training and the cold plunges, which you could just end your shower as well in that super cold. Like
correct.
If you live in New York and it's winter.
That's perfect.
This is going to be so cold.
It's perfect. Yeah, exactly.
Okay, so I have a question. Is it a myth that lack of morning wood is a health problem?
All right. Lack of morning wood. So, I guess your audience would know that that's an erection that men have. They wake up with an erection.
Yeah.
It's not a health problem. Okay. Now, men, as they get older, they experience it less in the morning, but they do have 3 to 5 a night. So there is a technology out there that's probably here in this conference. It's like a Fitbit to the penis.
Yeah.
Right? It's called Firm Tech. I have no association with the company whatsoever, but you can actually measure the strength of an erection overnight and how many a man has.
Okay.
So that's one way to differentiate, is it really a physiological problem or a psychological problem?
Okay.
That said, if men, if they don't wake up with one or don't experience one, then that's not a big deal. But they should get about at least 3 every night. And there's no way of knowing. Unless someone's monitoring you every night. Exactly.
Yeah, your partner's sitting up.
Right, exactly.
Watching you.
Right. Oh, I'm behind a computer getting all that data from the Firm Tech. Wow. This is a good one here. 2 a.m. Wow.
Okay, so if you get to a certain age and you're like, I never wake up with morning wood, that's not necessarily a problem.
No.
When would it be a problem? Like, what else would you have going on that's like, okay, if you're concerned about that, check these other symptoms?
Well, if they don't experience any erection for about 3 months.
Okay, at all. Okay.
Red flags.
Okay.
Red flags. It could be a metabolic situation. It could be a diabetic situation, or pre-diabetes, actually.
Yeah.
It could be a cardiovascular situation where the vasculature is not in good shape to get the blood in, and that can be indicative of a heart situation or a heart attack even. So men, typically, studies have shown men that don't get erections for a prolonged period of time have higher risk of a heart attack or a stroke.
Okay.
So it's really, a barometer to a man's health. And that's the other element, the other organ that a man has that women don't have to determine, the state of their health.
That is fascinating.
Yes.
What is something that you wish every patient knew before they came into your office that would just like help them so much more with their hormones?
I wish that they knew that to make sure it's checked.
Okay. How often should someone check their testosterone?
So I'll say that because it's not, a lot of physicians are not testing for it unless they come up with symptoms, but a lot of men don't talk about these symptoms. They are still ashamed to talk about, I'm not, feeling, my libido is low or my erection is not great. They're not openly talking about this. And they're definitely not openly talking about this to their female physician. See, so they need to advocacy, right? Self-advocacy. Get a full panel. The full panel needs to be not only total testosterone, which is what it's ordered. It needs to be total. It needs to be free testosterone. Then the free percentage could be calculated on online. SHBG, estradiol. I include cortisol, morning cortisol, in there as well, because there's a ratio there that it should be looked at, and dihydrotestosterone and DHEA. So a man produces testosterone, right? And you have enough free. One of three things happens. The testosterone itself hits a receptor and something happens, some male stuff, whatever. It's converted, it's the other way, it's converted to estradiol. So now a man has the estrogen in their body from conversion. We don't make estrogen. You guys do. We don't. The third thing is it's converted to dihydrotestosterone, DHT. And so DHT is actually binds to these receptors 2 or 3 times stronger than total testosterone. So a lot of the male characteristics comes from DHT. It's not a bad guy. And that's the other, I guess, thing that men need to know. Why? One of the drugs that's used is a DHT inhibitor, either to for their prostate or to grow hair. So whether it's finasteride is the drug, right? And it lowers DHT. Great, you have hair. But you can't do anything because now oftentimes men are feminized from it. And there's like all kinds of finasteride syndrome going on, depression and things like that. So clearly, I don't take finasteride. As you can tell, because I have no hair.
You're like, I'd rather be in the mood than have hair.
And I figured that out 30 years ago. So that's a full panel that includes DHT as well. And men who are, actually jokes aside, men that, want to keep their hair and all, be careful with finasteride, I would say. And I was low dose, and finasteride syndrome is about 2 to 3% of men who take it, but it's really no good. So
what does finasteride syndrome look like?
Depression. That they didn't have before. Erectile dysfunction, low libido, like a lot of feminization that occurs through the consumption.
Are we talking man boobs?
Can
happen?
Yeah.
I think that's important for people to hear, because I think it's really easy when men start to see breast enlargement to just think like, oh, I must be out of shape, I must be gaining weight, and not realize that this could actually be a sign that there's issues with their hormones, and they need to pursue that because that can lead to other issues in the body. Correct.
They're estrogenizing. I think I just made that word up, actually. I never heard estrogenizing.
I like it. It's true. What about saw palmetto as an alternative?
So saw palmetto, I guess you're mentioning it because it should be on some of the literature a 5-alpha reductase inhibitor, which means that it reduces the conversion of total testosterone to DHT. It's actually very weak in that regard, and I don't want to lower my DHT. There's no reason to. So there's don't believe the hype, right? Don't believe the hype. You don't need to lower DHT. Yes, if your total testosterone and your DHT, it's all about ratios. That ratio is off, then your prostate will grow, and no one wants a big prostate. So roughly a good ratio is about 12-1, total testosterone to DHT. If it's much lower than that, then there's just too much DHT, and it can make your prostate grow a little bit. But I don't want to go into prostate, but I'll say this. I mean, somebody's going to listen, oh, so how big the prostate? I'll say this. A bigger prostate doesn't matter. What matters is the urinary problems that come with it. Some people have a big prostate, no urinary problems. So bottom line is, you don't need to take these drugs that I think are more of a problem than a solution.
You know, saw palmetto has been studied so extensively in men, but I find it's actually better used in women because it is weak.
Yeah.
It can help with like PCOS, hair loss.
1,000%.
It can help with so many women's health issues, and they don't need all of this DHT.
That's
and
right.
because it's not such a strong arm to shut things down, it works a lot better. But I was curious
great point there. Thank you for that.
Yeah, but I was just curious from the male perspective because I think, you know, hair loss does come with, you know, a loss of self in some instances. Like it can take a mental health toll.
Yeah.
And so I think people need to look at weighing, you know, the ratio, as you said, and the cost to benefit, because becoming depressed, becoming feminized, like that's, I mean, if you think losing your hair is bad, you might want to consider what it looks like when the tissues start to shift to be more female body archetype.
As you can imagine, not too many come to see me for hair loss. Mm-hmm. They just look me up and it's like, that guy may know nothing. Nothing about hair loss. So
well, I wasn't going to ask you about hair loss.
He's not the guy for that.
Yeah.
But jokes aside, a few times that I did try with some people for that regard, and they felt like their DHT was too high and a problem because they want TRT and things like that.
Yeah.
It's not as strong. Okay. In those few times but again, and I don't think DHT under normal circumstances, under natural circumstances, DHT is not a problem. When men are using TRT, not that I'm opposed to it, I think it's great for many men, but then you got to really look at those labs and see what is it converting to what.
Yeah.
If it's converting too much estrogen is a problem, and if it's converting to too much DHT is a problem.
Mm-hmm. Well, that's a perfect place to wrap. I think we should do another episode where we talk all about testosterone hormone replacement therapy, the ins and outs of that for men. As always, you guys drive the conversation, so you can leave comments. You can let us know. What questions do you still have? What should we have Dr. Geo Espinosa back to chat with us about? But for today, I want to thank you so much for giving us your time and sharing all of your knowledge.
Thank you for having me. It was fun. Thank you.
Yeah. I hope you enjoyed this episode. If this is the kind of content you're into, then I highly recommend checking out this.